everyone. Welcome to this session on Nursing Informatics and Innovation. My name is Dr. Kelly Aldrich. I'm an informatics nurse specialist, board certified, as well as an associate professor at the Vanderbilt School of Nursing, where I teach informatics. I have always been focused on innovation in informatics around my career. I'd like to share with you some of my observations, and as part of this lecture, I'm re-recording this from an orientation session that I did for our students recently, and it ties in with the AACN and Apple Digital Academy that I was part of in 2021. You can feel free to use this lecture in your courses, or listen to the lecture and see if there's any of the material that you can incorporate into your lessons as you move forward as faculty teaching informatics and innovation. So what's new in innovation? Let's talk about some background. I want to review the background. Let's look at some trends, and can we get IT past the hype and move to transformation? Oftentimes people get caught up in what is innovation. Everyone has their own definition, but ultimately what you're looking at is improving a certain area by people, process, technology. We'll talk about that, but moving it forward in a transformation that has a positive impact. So yes, we do need to measure and have metrics around this. In review, and an amazing resource is this Scope and Standards of Practice of Nursing Informatics. Now, this is the second edition by ANA. The third edition, I am part of a group of authors, and the publication for the third edition should be coming out sometime this year, we understand. And so I just want to point out, this is a really useful tool if you're teaching informatics or learning about nursing informatics. I have written many job descriptions from this resource, and I pulled out a few of the things that I thought really related to informatics practice as we talk about background. So looking at this, we want to examine incorporating telehealth and newer technologies, the provision and research and administrative processes, designing and facilitating changes in care models in response to evidence-based practice outcomes as they evolve away from episodic care toward more predictable and preventable models with collaborative interprofessional care teams. I thought several of these excerpts were just really insightful and meaningful potentially as you are building your curriculum. Now, another resource that you should be well aware of is both Two Eras Human and the following publication, which was the Institute of Medicine, which is now National Academy of Medicine, is Crossing the Quality Chasm. This is by doubt, in my mind, a very useful resource. Their observations and ideas and solutions to move healthcare forward using technology are really grounded, and I would really strongly encourage you, even though this was written in 2001, I often reference this in lectures and as I'm talking or working in national committees that I sit on. This is just a really great resource. So healthcare, and you'll see why as you look at it, but in particular, healthcare has safety and quality problems because it relies on outmoded systems of work. Poor designs set the workforce up to fail regardless of how hard they try. This just got me because it's so true. We're recognizing this and we're publishing this, and yet what are we doing to solve this? Thus the innovation focus of recent. If we want safer, higher quality care, we will need to have redesigned systems of care, including the use of information technology to support clinical and administrative processes. So if that was on page 4, imagine what is in the rest of the book. Now, let's look at what we have that's working as design in healthcare. Oftentimes, we reference the airline industry, and I want to point out some interesting facts here. So you see the dashboard, advanced technologies, a large tablet, the person is seated, they have the full vision, very situation awareness, everything is involved here for their information to be able to see and guide the pilots as they move forward. There's no wonder that we often reference this model. And then on the right-hand side, this is actually a picture that I took in one of the ORs that I was visiting. And when I look at the parallels between the two in the situation awareness and the management and throughput and the operations impact here, there is no wonder that the boards, the very pretty boards that were installed above the grease boards, are just sitting there stagnant, and it is actually the workflow and the processes below that are managing entire OR systems. So I think you can see the irony here as we just dismiss this useless technology that was probably very expensive. Someone has to put in that Excel spreadsheet. You notice it's not even pulling over from any systems, but it is a very nice display of data, I guess, but below is really where the work is happening. If you even notice the tilt in the magnets or the colors that they use, all of this is actually how we manage in healthcare, which is an interesting concept that we all understand, but we have to also be engaged in innovation so that these systems are designed to work for our clinicians, mostly our frontline nurses, to reduce the burden on them by using technology. So this is really, frankly, where we thought we'd be with meaningful use. We thought that we would be able to have this interactive, very cutting edge data, information, knowledge at our fingertips. We would be slick and moving forward. I love that this person still has a stethoscope because it's still the best tool. But quite frankly, this is where we are. So many people have described this and discussed this as they go see their providers, or in an intensive care unit, people have their backs turned to patients. And it's just really a fact of this is where we are. So I love Albert Einstein, very knowledgeable quote here: no problem can be solved within the same consciousness which it caused it, right? No argument there. So it is our responsibility to understand that informatics and innovation go hand in hand, but they are not to be treated in a silo. They must be addressed holistically together with all of these elements in healthcare. The person is in the middle. Is that you as a patient? Is that a loved one? Is that someone when you're on duty that you're caring for? There's a person in the middle of this ecosystem. We have the health system, the healthcare access around them. We have government and regulatory influencing what we do and how we do it in health systems. And then there's a balance in the marketplace where we have clinician needs, we have technical solutions. In the ecosystem, we do have business cases that influence the economic, and then we have our vendor partners in the ecosystem providing products and solution, new innovation companies popping up all over the place to try to help this health system deliver care at the front line and through the continuum of care. So let's talk about some definitions. Just about every presentation that I give, I reference this. Dr. Friedman, just brilliant observation. Obviously, the theorem of biomedical informatics, which is informed process in clinician, right, are not necessarily equal. But when you add the system effectiveness, this incorporates clinician informed process and the clinician together. It doesn't replace. Technology does not replace. It just enhances and supports. That's the key message here. Now let's look back at the National Academy of Medicine Socio-Technical approach as they're talking about improving patient safety, which requires a learning system built from a socio-technical approach. People, process, and technology. We have to examine this, and this is key to incorporating into any informatics curriculum. You cannot focus on technology without looking at the impact of the people as well as the process. This is all a very dynamic and should be lessons learned, move forward, adapt, grow, move forward, incorporating all of these elements. Safety is a characteristic of a socio-technical system. System failures often mostly occur because of unforeseen combinations of component failures, meaning we just looked at one section of this and not all. So clearly you understand this, that's systems failure. Something that is a perfect example is alarm fatigue. The single notification is meant for good, but when you look at the impact of all of the environment of care through the processes, you understand the impact on people. And then we have silos of data. So we want to make sure that we're looking at patient focused, safe, connected, interoperability of HIT, systems approach, human computer interactions. What is the usability factors? Where is the human computer interaction usability components? Those are key in depending on what environment you're in. And then I found this, which I thought was a really nice breakdown as we move forward in the lecture, of systems thinking, futures thinking, and design thinking. Oftentimes I find myself blending the three of these together, where I'm actually looking at is a gap analysis. So what is the ideal state today? Well, the ideal state of a certain problem or something you're looking for a solution for. Maybe there's been a death, maybe there's been an impact to quality or safety, and you want to do a design session to actually address that. I find that there are specific definitions for systems, futures, and design thinking, but I personally find myself in the informatics world blending a lot of these. What we do need to pay attention to is the current state evolving towards better care, expanding the portfolio from point of care solutions or that particular use case in the system of care. That's how we look towards transformation. So ultimately the impact of the person is that it's a patient, but then if you expand out or scale, then we have persons that are affected. And then if you also scale that up, then we have public and population health effects. So we have to look at high valued use cases and coordinate this path to transformation. One single idea won't necessarily transform a healthcare system from something that we know from to err as human, crossing the quality chasm. But ultimately, as we look at this from a systems of care, we need to have an impact. And of course, that's where we're looking for improvement. So can we move past the EHR centric environment just for this discussion? Thank you for entertaining me on that. But I really have to say that when you talk to different nurses, I've been in nursing for almost 40 years. I have friends who are still at the front line working in ICUs, and their focus is not on what key they hit on that keyboard. It's just part of the process. So I want to move us out of the EHR centric environment and start thinking about understanding what users want or need and how a particular design will affect and, quite frankly, create a solution in their lives. And this is crucial. And that's where the design thinking comes in, using the technology, data, and innovation. This is a model, and I reference in my notes in the publication, the Penn State have done an amazing job. There's a link to the resource that you can actually go out and take a course from them, and they go through all of these steps. I'm providing a high level for purposes of this lecture. But the idea is in design thinking is that you empathize with a problem. Well, it's interesting to me to hear that we have to, as nurses, empathize any problem because we truly understand what the impact is on our care environments, and so easily nurses can identify where there is a workaround, where there is a gap, how to do something more efficient, effective, and inclusive, and which will also contribute to meaningless innovation, misallocation of resources. It encourages collaboration and brainstorming ideas to create solutions. This is a team-based approach. This is a terrific way for you to look at what is a problem. So when you're teaching, you want to help identify this concept of empathize, defining the problem, ideate. This is the opportunity to either do single projects or group projects to come up with a problem. Maybe they use a sticky board activity and they're posting stickies of ideas all around. They can prototype and test. How I incorporate the test from my teaching plan is they actually have to present back what their solution is in more of a nurse pitch approach, which is an effective way of communicating that nurses need to also be at the table and taught how to effectively communicate these ideas. Interoperability maturity model. If you are an informatician, this will really delight you. This is a model from the Center for Medical Interoperability created by Dr. Bill Stead, who is one of the probably most published informaticians. He's an amazing resource. You can reach out to him. Bill Stead is amazing. He has helped me by recording lectures. In talking about this. This model is also featured in the National Academy of Medicine, Procuring Interoperability, another advanced level informatics resource. But the idea here is that within that episode of care, where you see all of those screens, but yet the patient and the caregiver right there at the bedside, how we look at the parallels again of the airline industry and how they have created the dashboard and the situation awareness around the pilot, we seem to have the direct opposite. These are components that if you walk this around the wheel of infrastructure, including cybersecurity, syntactic, semantics, so that we're saying the same things. And then what's really important to our bedside clinicians is the orchestration and the contextual dynamic interoperability. This is a whole hour lecture in of itself, but this is, again, to introduce that we're holistically looking at this. So there's a path forward. How do we see the path through all the trees? You know, where are we going with this? Where am I trying to lead you? Well, examples from the 2022 American Nurses Association Nursing Informatics Scope and Standards, which again, as I told you, is being released this year, is around using usability and design principles to maximize negative impacts and minimize negative impacts, and maximize positive impacts of technology, data, information, and communication on workflows found in health systems. Another focus is analyzing, designing, and implementing effective user experiences for the nurses and the whole care team. And another idea that really resonated was using expertise in applied clinical informatics to reduce or eliminate the burdens of current and developing technology, information, and communication solutions. So if you think this is too much, this was in the public comment document. If you think this is too much, it's really not. It is advanced informatics, but your focus of innovation is around number 3. And you can embrace that and use that, incorporating that in your lesson. So I do want to talk about the current trends, as I had said. So American Nurses Association is looking at education, research, and resources. They've recently started an innovation committee, which just launched in January. I am grateful to be part of this team. I am part of the new care delivery models, and we're meeting to sort out what our objectives and goals are. So it's really great to see that the focus on innovation from a very large level, ANA, and helping us more to come moving forward. But you could certainly use this as a resource and look at the postings and solutions that will be forthcoming. I really admire Shauna Butler. She has focused on innovation and transformation in nursing. You can find her on these podcast channels, different avenues, but she has a fascinating story, and I'm really impressed with her work, how she interviews so many nursing leaders, frontline staff, just really gets down to some solutions. But this is a great resource for you to reference her work as well. There is a Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders, SUNSEAL. Their mission, as you see below, is to magnify, network, and elevate nurse innovators' expertise as transformation agents who contribute to healthcare reform. It's a wonderful organization. I have joined this myself and participated and hope to be able to engage more. This is a really interesting opportunity if you have students who are really creative and out-of-the-box thinkers. That is not something that we have traditionally fostered in schools of nursing, but we're seeing more and more of these innovation curriculums. And as you know, with Domain 8 in the Essentials, incorporating informatics and innovation, this is a key part. What I found is that we are looking at several domains of interest. Domain 8, which you'll see in the e-publication book that's associated with this lecture, informatics and healthcare technologies. Domain 5, quality and safety. Domain 6, interprofessional partnerships. Domain 7, systems-based practice. Number 9, domain 9, professionalism. And domain 10, personal, professional, and leadership development. All of them, all of these domains that you're looking to create from the essentials, the new essentials from 2021 guidelines into your curriculums are incorporated into this concept of innovation and the example that I gave on the innovation activity challenge. In addition, we're seeing a lot of these hacks pop up, these nurse hacks. This was started in the technology space and is being sponsored and brought in to start elevate nurses' thinking towards this. You can look at these resources. Again, SUNSEAL, Microsoft, J&J, there's a lot of sponsors in this space. I just strongly encourage you, if you use this approach in your course, I think it's fantastic. Make sure that to encourage students or colleagues to get involved in this, but please notice the release forms in the IP that you're signing along the way. Another resource, the Nurse's Guide to Innovation, Dr. Bonnie Clipper, love her. If you don't know her, follow her on Twitter. She is always, always, always hashtag as a nurse posting something inspiring. This book is amazing. It might just be a nice supplement guide that you provide to your students. And then within an innovation roadmap, a guide for nurse leaders that I have referenced in the back. This idea book can serve as a jumping off point for nurse leaders who wish to introduce the spirit and practice of innovation in their organization. Again, promoting a culture of innovation truly with the inclusivity and the divergent thinking, allowing them the flexibility and allowing them the autonomy. This is such a powerful way to engage communities and to empower nurses to really think differently than following orders. We are such an amazing profession, and we need to move forward with our ideas that are not defined by engineers and others who, because they're married to a nurse or have a nurse sister, think they know the solutions for us. I am totally 100% on that bandwagon. You will always hear me talk about that it's the nurses who need to be leading in this space. Thus is why I included the domain 10 of professional, personal, and leadership development. So in the innovation activity train, moving forward, we're seeing more of these ignite and quick fire challenges. Again, this is just an opportunity for you to introduce this to your students. There are multiple quick fire challenges and hackathons out there. Simply Google them, follow them on Twitter. You'll follow the hashtag. I wanted to put this here. This is Dr. Holt who's the head of our simulation lab at Vanderbilt. And this is Noah Robinson. I have mad respect for this man. He is completing his PhD in cognitive behavioral therapy and has created a company called Help Club. It's a virtual metaverse environment that could be leveraged in the metaverse. But Joellen actually has the headset on. You can download it to your desktop and so forth. What we're doing is we're creating well-being, mindfulness, measurable experiences for helping reduce the burden of stress and hopefully instilling resilience and coping. We're going to leverage Noah's tool. We're just doing this now. This is February 22, and we're just looking at what could this be. I can remember when I was the Chief Nursing Informatics Officer of HCA, over 170, 80 hospitals, I used to think about this thing called Sparkleville, and how can we apply gamification to mental health and well-being, building coping and resilience, creating efficiencies. And so this is what we're looking to do in this space. There are many organizations like B1 Support One, amazing organization. There's a new group that's spun out of a hackathon that I was a judge called Parachute. We're looking to incorporate all of their ideas within this to hopefully focus on nursing at the front line, traumatic experiences, and just allow them a way to decompress and use potential virtual reality training to help support them in their ability to stay as a nurse. So this is just a beyond a passion project for Joe and I. Patty Sengstack is 100%. We are just collaborating on this to see where we can take this. If you have interest in this, tag me or email me, and let's talk more about how we can do a multi-facility adoption or implementation and testing of this concept. Really think this is going to be really helpful, but we have to test it out, right? It's part of the learning process. It's part of the innovation challenge, how we've ideated, we empathize, we ideated, and Noah, interestingly enough, has a TED Talk on this concept and has worked with the Wondery, which is the innovation area at Vanderbilt. He's a Vanderbilt student as well. So let's look around. What's going on? The future of nursing is talking about innovation. You can't get out of your way with TikTok. LinkedIn, Twitter, Facebook has all of these social media platforms. I added some of the systemic review if you want to approach this from a scholarly reference to your students. But quite frankly, if you're not paying attention to TikTok, I think you might be missing the boat a little bit, and you might think, oh, that's a little crazy. Have somebody show you TikTok and look how many nurses post on TikTok about their day. And it's amazing. You can form LinkedIn communities with your students. You can have Twitter challenges. You can do a Facebook group. Any of these things with privacy, of course, a concern. Maybe people don't like to have their online presence. That's a whole nother topic for another day. Finally, I just close this out with the discussion around hackathons. Again, are they helpful? Do they actually help nurses with IP, intellectual property, move forward? Or is there potential for harm here? Is there potential for a large company to come in and take one of the ideas that someone has and remove that nurse from the ideating and from the prototyping? And it's just another area to consider. Again, when I was CNIO, I would work with the business development team, and they would text me when I was asking a product question to a vendor, and they would say, "You just costed us $1 million." And I was always kind of entertained by that, because quite frankly, I was just asking workflow process questions, and I would always see them writing down really quickly questions that I asked, and as a pattern, I kind of held my questions, but anyway, point being is, let's make sure that as we put innovation out there, we think about patents, we teach about patents, we think about intellectual property, we think about the implications of creating entrepreneurials and new businesses, and where's the resource? Look to the Wondery. We do have a very large innovation center, as I had said, that they have virtual classes that help you work through ideas. So I encourage you to look for that sort of format to help you create. You can either prove out a theory, or maybe it's good, maybe it's bad, but you need to reach out to these resources and find out where we're going. So thank you again for allowing me. These are my resources to introduce this concept of the essentials that they tie into this innovation activity challenge, that you can either take this recording and provide it for your students, reach out to me and ask me for the slides. I'm perfectly fine sharing these slides if any of them are of interest to you. It's kelly.m.aldrich, ALDRICH @Vanderbilt.edu. I apologize for not putting this in here. I'll see if I can attach it. And so thank you very much for your time today. I hope you have fun. That is a key part. Have fun, build relationships, and reach out with any questions. Thank you.